Starting on page 63, know the difference between primary and secondary or tertiary prevention efforts, and then also know the examples of each and be able to differentiate between those examples. Also, starting on page 67, in that article, know which substance use is most prevalent among adolescents and when, at what age, that is more likely to turn into substance dependence. Know what the differences are between personal and social influences that may tend to promote adolescent alcohol use. And then also understand what the studies have shown about young adolescents who have adult supervision or do not have adult supervision after school, and whether or not their participation in youth programs has any difference or makes any difference on their adolescent drug use. Is it the same? Is it lower? Is it higher? Does it make no difference? Know what those studies suggest. Beginning on page 83, understand the process of an intervention, the format, the methods, the dynamic factors, and then within those dynamic factors, understand the difference and the components of denial and enabling. Also, understand the examples of enabling, understand how to differentiate between them, and understand the general concept of enabling, as you will get questions on the exam asking you to identify what enabling behavior may be. Beginning on page 89 and going through 100, there is an outline of a program, a formal intervention program that was developed by Johnson Institute. Understand that program well, understand their concept and their structure well, starting with who the primary client is and going through how you wrap up an intervention and what a post-intervention session may include. Know the basic history of employee assistance programs and whether they were ignored or mentioned in the big book. Also, understand the different types of programs, such as labor-based or company-based, government-based. Understand the differences between those types of programs, and also the biggest hurdle to the use of an EAP by an employee. What is the most significant hurdle to a successful EAP? It's probably the fear by the employee that use of the program will hinder promotions or cause other problems related to the job. Who were the Washingtonians, or who made up the Oxford group, and when were those groups around? And how do they fit in with the timing of Alcoholics Anonymous? Know those differences. Also, know the common questions and misconceptions about 12-step programs, such as the disease concept. Why is it a disease? Why anonymity? Know the reasons, know the concepts, know the misconceptions, and understand why there may be the common misconceptions. Understand the psychological process of a 12-step program. Understand admission, submission, restitution, reconstruction. Understand the components. Understand what each one of those processes involves. Understand how it relates to the different 12 steps. For example, the submission process includes steps 4, 5, 6, and 7. And understand what takes place in each one of those processes. For example, in restitution, that may involve making a list of persons harmed by certain actions and then becoming willing to make amends to those persons. Understand the components of all of these processes. And finally, understand within that article that starts on page 113 and ends at 130, understand this one concept that this article discusses, and that is that integrated treatment which includes group treatment, is being recognized as a very effective approach. In other words, group treatment is being recognized as a good approach in substance abuse recovery programs.